my disability report, I have decided to report on Fragile X syndrome. I just read a story recently about a little boy named Max who was diagnosed with Fragile X syndrome. His parents called him the singing baby because as Max breathed, he let out a sharp, piercing whistle. Also, Max did not like to be touched or held, and when he was about 10 months old, he was still struggling to keep formula down. He had some different traits about him, such as protruding ears as well as an extra fold above his eyelids. He was developmentally described as slightly autistic as well as mildly retarded. He also suffered from hyperactivity, low muscle tone, gastrointestinal issues, as well as a tendency to have very high fevers. He is now in kindergarten. This article was written in 2008 and has just been potty trained. Fragile X is known as a disorder of excess because it involves several connections to the brain. Some characteristics of Fragile X syndrome, which is also known as FRAXA, are that it can cause troubles ranging from learning disabilities to mental retardation. In most cases, mild to moderate mental retardation is common. Most males experience moderate mental retardation, while most females experience mild mental retardation. Some physical characteristics include an elongated face, a larger head, prominence of the chin and forehead, as well as protruding ears, such as Max's. These features are common, but they usually do not develop until puberty, which was not Max's case, obviously, since he's only in kindergarten. Social and emotional difficulties may arise. Speech and language concerns can involve, and aggressiveness in boys and shyness in girls has been reported. Fragile X syndrome is not curable, but many of the side effects can be treated in a variety of ways. About 1 in every 2,500 males are affected by Fragile X syndrome, and about half of these males show signs of autism. This means that Fragile X syndrome causes about 5% of all autism cases. Women are also affected because women have 2 X chromosomes and males have 1 X chromosome and 1 Y chromosome, the effects are not as prominent because they have 2 instead of 1. Many are carriers of Fragile X permutation, which can lead to premature menopausal or neurological symptoms. This disease is a result of a defective gene on the X chromosome, which is one of the pair of chromosomes that determines gender. The disease is caused by difficulty with a specific gene called the Fragile X mental retardation 1 gene, also known as the FMR1 gene. Usually the gene produces the protein needed for proper brain development, but when the gene is mutated, such as in Fragile X syndrome, the gene produces little or no protein. If there's only a small change in the gene for mutation, the individual affected may not show many or any signs of having Fragile X syndrome. But as you can gather from the list of side effects that I listed above, some individuals are faced with very severe symptoms. Any individual can carry the Fragile X trait or permutation, but not necessarily be affected by it. Fragile X syndrome is inherited. However, parents can have children born with Fragile X even when they are not diagnosed. The disease's symptoms do usually become more serious when they are passed down from parent to child. There's no cure for Fragile X syndrome, however, the symptoms can be treated, as I said before, and there are fortunately a variety of ways to treat these symptoms. If the child affected receives proper education, behavioral or physical therapy, as well as medication, many of the symptoms can be at least minimized, helping the child to perform and master quite a few self-help skills. Early intervention is very important when dealing with Fragile X syndrome because the sooner the child receives treatment, the better their opportunity for learning becomes.